Assalamualaikum. My name is INSYIRAH binti Muhammad ARIFF and I'm from DPH 18. My matric number is 320412211012. Today, I will present Pharmacology subject, which is my individual video assignment, and my lecturer is Puan Mazwin Kamis. The first page that I presented is basic of pharmacology that I have learned from video 1. Pharmacology. What is a pharmacology? Pharmacology is a branch of medicine, biology, and pharmaceutical science concerned with drug or medication action. In pharmacology, we have term of drug receptor, which contains receptor, agonist, and antagonist. Receptor is a specific protein that receives chemical signal from outside of the cell membranes, such as binds with substance such as hormone, antigens, drug, or neurotransmitters. Next, we have agonists. Agonists bind to their receptor and exert an intracellular effect, such as drugs that stimulate receptor. For example, caffeine. We also have antagonists. What is an antagonist? Antagonists bind to their receptor without exerting an intracellular effect, such as alcohol. Moreover, from that video, I'm also learned about pharmacokinetic. What is a pharmacokinetic? Pharmacokinetic is a movement of drug in the body with emphasis on its distribution, duration of action, and methods of excretion. In pharmacokinetic term, we have absorption, metabolism, distribution, and excretion. First, I'm going to explain what is about absorption. Absorption is the process of a substance entering the body, while distribution is the dispersion of substance throughout the fluids and tissue of the body. Next, we have metabolism. Metabolism is the irreversible transformation of parent compounds into daughter metabolites, while extraction is the elimination of the substance from the body, and also some drug irreversibly accumulate in a tissue in the body. For example of drug, I have amlodipine 10 mg tablet, which is a root oral. Amlodipine is a dihydropyridine CA channel blocker that reduces peripheral vascular resistance. The absorption well absorbed from the gastrointestinal tract, while the bioavailability is approximately 16 until 65%. The time to peak plasma concentration is 6 until 12 hours. Moreover, the distribution across placenta and enteres breast milk, and the volume of distribution is 21 L per kg. Metabolism is extensively metabolized in the liver to inactive metabolite. And the last one is the excretion is via urine, 60% as metabolites, 10% as ancient drug, and terminal elimination half-life is 35 until 15 hours. In this video, I have learned 3 points, which is I have learned special delivery of pharmacokinetics. Number 2, I have learned the function of drug receptor, and I also learned the factor of the pharmacokinetic. In this second video, I have learned about absorption. What is absorption? Absorption is a drug's enter from the site of administration into the bloodstream. In absorption, we have bioavailability. That is the proportion of the administered dose that reach the systematic circulation. When a medication is administered intravenously, its bioavailability is 100%. However, when a medication is administered via other routes, such orally, its bioavailability decreases due to incomplete absorption and first-pass metabolism, such as liver. Next, we have factor influencing bioavailability. What is a first-pass hepatic metabolism? It is a GI absorption occurs throughout the portal circulation, which pass throughout the liver prior to reaching systematic circulation. And if the drug metabolism occurs in the liver, this process diminishes the drug reaching the systematic circulation. Next is drug solubility. It was extremely hydrophilic, which is a lipophobic drug poorly absorbed across the lipid-rich cell membranes. Its extremely hydrophobic drugs are also poorly absorbed because they are insoluble in the aqueous environment of the body, which is rapid absorption requires a combination of lipophilic and aqueous solubility. Next is chemical stability, which is drug for oral administration must be resistant to gastric acid destruction and degradative enzyme in the intestine, which is insulin. The last one is nature of drug formulation, which is enteric coating resists gastric acid polymerization, particle size, crystal structure, and binding agent can affect absorption independent of active drug properties. For example of drug, we have Invega paliperidone, that's route is oral. Paliperidone is a typical antipsychotic, which is the major active metabolite of risperidone. The absorption, which is bioavailability, is 28%, and time to peak plasma concentration, which is oral, is approx 24 hours for 13-day monthly injection and 30 until 33 days monthly injection and 29 until 32 days 6-month injection. The excretion is via urine, approx 80%, approx 59% as unchanged drug, 32% as metabolites, phase 11%. And the last one is the elimination half-life, approx 23 hours. In this second video, I have learned the process of absorption and learn how to make a right curve of blood concentration of drug and learning the factor influencing bioavailability. Next, for the third video, I have learned about distribution. What is a distribution? Distribution is a drug reversibly leaves the plasma and enters the extracellular fluids to reach cell and tissue. In binding of drug to plasma protein and tissue have three things, which is binding to plasma protein, binding to tissue protein, and hydrophobicity. What is binding to plasma protein? Binding to plasma protein is drugs bind to plasma protein, which is albumin, reversibly, and increase the non-diffusible from the slow to transfer out of blood. Capillaries act as reservoir. Next, binding to tissue protein. What is the binding to tissue protein? It is accumulate in tissue, which is lipids, proteins, or nucleic acid, or those site high concentration can act as reservoir, as prolong the action and can cause local drug toxicity. And the lastly is hydrophobicity. Hydrophobicity is the hydrophobic can cross the plasma membranes, which is lipid bilayer, to hydrophilic drugs cannot penetrate cell membrane and must pass through the slit junction. Next, we have the volume of distribute. The volume of distribute is a hypothetical volume of fluids into which a drug is distributed. When absorbed into the plasma, a drug can be distributed to one of three or all three distinct fluid compartments, which is plasma compartment, 6% body mass, and extracellular fluid, 20% body mass, and intracellular, 16% body mass. Plasma compartment, 6% body mass. Plasma compartment is a free drug plus protein into protein to drugs complex. For example, is warfarin 99.9% bound to albumin and paracetamol 15% bound to albumin. For extracellular fluid, 20% is a lower molecular weight drug that a hydrophilic can move through the endothelial slit junction and into the interstitium. They distribute in the extracellular space. For example, is aminoglycosides antibiotic. And total body water 16% body mass is hydrophobic. Low drugs are able to move through plasma membranes to intercell, such as in ethanol. Apparent volume of distribution. A drug rarely associates with only one compartment, which is volume of distribution relates the amount of drug in the body to the concentration in the plasma. For example, is ketoconazole. The route is topical. This topical is an imidazole antifungal agent, inhibit fungal activity. The pharmacokinetic, which is absorption, variably absorbed from the gastrointestinal tract, and the bioavailability is decreased as gastric pH increase. Time to peak plasma concentration is approx 1 until 2 hours, and distribution is widely distributed into tissue including inflamed joint fluids, tendons, saliva, sebum, cerebral, bile, face, urine, taste, skin, and soft tissue. The excretion mainly via face is 57%, while the elimination half-life is 2 hours initial and 8 hours terminal. The learning point that I get from the third video is I have learning the binding of drug to plasma protein and tissue and how to calculate the volume of distribution. For the third video, I have learned about metabolism. What is the metabolism? The metabolism is the irreversible transformation of parent compound into drug metabolites. There is bioinformation that leads to the product with increased polarity, easy for elimination, such as the pathway of drug. Metabolism can be divided into phase 1 reaction and phase 2 reaction. On the phase 1 reaction is a small polar group that contains positive and negative. It's either exposed on the toxicant or added to the toxicant. There is 3 main phase 1 reaction are oxidation, reduction, hydrolysis. For the phase 2 reaction is conjunction reaction. A molecule normally present in the body is added to the reactive site of the phase 1 metabolites. Next is an example of drug, which is the medicine is aflatoxin. The route is topical. Aflatoxin is an antibacterial which inhibits bacteria topoisomerase 4 and DNA gyrase enzyme request for DNA replication, transcription repair, transposition, and recombination. The pharmacokinetic, which is absorption, rapidly and well absorbed from the gastrointestinal tract. The bioavailability is approx 98% oral. Excretion via urine is 65% until 18% as unchanged drug, 5% as metabolites, phase 4 until 8%, and elimination of life approx 9 hours, basic approx 4 until 5 hours, and 20 until 25 hours. What I learned from the fourth video, I have learned what is metabolism and learn the biotransformation and learn the phase 1 and phase 2 reaction. For the last video is extraction of drug. What is extraction of drug? It is requires the agent to be sufficiently polar for efficient extraction. Route of extraction is a major and minor. What's in major? Major is renal and bile, while minor is intestines, lungs, milk, sweat, saliva, tears, hairs, and skin. Next is a clearance, the volume of plasma from which the drug is completely removed per unit time. The amount eliminated is proportional to the concentration of drug in the blood. Rate of elimination, clearance, multiply concentration in the blood. There is two types, which is zero order, that constant amount eliminates alcohol and other easily overdose, and the first order is constant fraction eliminates 95 of drug. The example of drug is linagliptin, which is the route is oral. Linagliptin is an enzyme which is involved in the inactive of the incretin hormones. The pharmacokinetic, which is absorption, rapidly absorbed from the GI tract, and the bioavailability is approx 30%. The distribution is extensively distributed to body tissue, while the concentration depends 99%, which is low concentration, 70 until 18%, and high concentration. The metabolism not extensively metabolized, and the excretion were phase approx 18% and urine 5%. Okay, for the last video, I have learned about extraction process and the calculation of clearer. Okay, that's all from me, and thank you for watching my video. I hope Puan Mazrin understand what I explained about, and sorry for the any mistake, and thank you.